Happy World Autism Month. Here's a fun fact about autism. Did you know that hyperlexia, which is known as the ability to read above one's grade level at school, commonly accompanies autism? Hello there, this is Bradley, and you're listening to Psych Everywhere, a podcast by Psi Chi, the International Honor Society in Psychology. For this show, distinguished guests weigh in on applying psychological science to a diverse range of current events and to better your life. Today's guest speaker is Dr. Lydia Qualls, who's going to answer questions about misconceptions and little-known facts about autism. I first heard of Dr. Qualls when browsing the 2022 SIPA convention program, and I noticed her workshop there on autism as culture and autistic college students. And I immediately jotted down her name for an upcoming episode of the show. Dr. Qualls is a licensed clinical psychologist at the Cook Counseling Center. She earned her bachelor's at Vanderbilt, her master's in psychology at Old Dominion, and her PhD in clinical psychology from the Virginia Consortium program in Norfolk. And guess what? I just found out a few minutes ago that she's also a Psi Chi member. Dr. Qualls has conducted numerous research studies on autism regarding improving reciprocal interaction, emotion regulation, face processing and social interaction, sexuality, and sexual minority orientation. And I'd be remiss to not mention that in addition to her work on autism, her interests also include anxiety for young adults and LGBTQ plus young adults. Dr. Qualls, welcome to Psych Everywhere.
Thank you. It's very nice to be here.
Well, I was really excited to do this episode today. I was wondering, let's just start off with kind of the basics, I guess. Could you tell me, I'm hesitant to use the word symptoms. Could you tell me the characteristics of autism?
Yeah. I think using characteristics instead of symptoms is the right phrasing. I'll describe it kind of using some of the symptoms listed in the diagnostic manual, but viewing them more as characteristics instead of symptoms. So I would say autism really consists of different methods of social communication and specific patterns of behaviors, interests, and activity. This can look like maybe having difficulty reading or responding to others' emotions or facial expressions, or having to exert more effort to do so or respond appropriately with their own facial expressions. Many autistic people may have difficulty with nonverbal communication, such as, like I said, facial expressions, hand gestures, or social relationships, especially with allistic, which is a word for non-autistic people. Another part of the criteria involves specific patterns of behavior, interests, and activities. Many autistics may feel more supported by at least some routine, may have special interests that they know a lot about and enjoy, and may also do stimming, such as flapping, or do verbal or vocal stems. And they also may have some sensory differences, including hypersensitivity and hyposensitivity.
How common is autism? Do we kind of know how many people have it?
Yeah. So the current CDC estimates are at least 1 in 44 children, although adults have it too and are often underdiagnosed because it's difficult to get a diagnosis as an adult. The typical stats are 1 female to every 4 males, but that gap is closing. When I first started doing my research a little under 10 years ago, it was 1 in 7, and now it's down to 1 in 4, and I suspect it'll go even lower because the diagnosis is really based on cisgender white males, and it's also easier for white children versus children of color to get diagnosed.
I'm wondering, what should I know about autism in terms of who has it? And I think there's some confusion sometimes about how they got it.
Yeah. So it's, not something so much you get as something that you're born with, at least born with the genetic disposition to. It's a heterogeneous disorder, meaning that there's multiple causes, but it is actually one of the most heritable disorders, meaning that if a person is autistic, at least one of their parents have at least some traits of autism, and most people can tell you which parent. Also, there's an interaction with the environment. Sometimes environmental challenges may make autism more likely to develop. such as those occurring in birth and early childhood, or it may influence how autism is expressed. Although I always have to say when asked this that vaccines do not cause autism. It's one of the biggest debunked studies about autism.
So if people have autism all along, at what age do the symptoms tend to appear, or how soon can we detect it?
Most times I think people are able to diagnose it with fair confidence. Symptoms usually start showing up around age 2, although moms say they've noticed like certain patterns of behavior earlier, like not crying, their infant not wanting to interact with them as much. The ADOS, which is the Autistic Diagnostic Observation Schedule, one of the gold standards for determining an autism diagnosis, has modules that go all the way down to toddler age. So there's screeners that can do confident diagnosis from about 2 years of age.
Wow, that young.
Yeah, but one of the caveats from the criteria is that sometimes symptoms may not fully manifest until the challenges in the social environment outweigh the person's ability to cope with them. That was actually the case for me. I didn't figure out I was autistic until grad school, where things got sufficiently complicated for me to make that connection.
Since you mentioned that, if someone thinks maybe they're autistic, but they're not sure, how should they go about finding that out?
I practice kind of what's called the community collaborative diagnostic model, which is a term that I think I made up. But it's kind of the way I work with students is kind of taking what they think makes them have autism and hearing that, we compare it together to some of the diagnostic criteria, compare it to experiences I know of people that have autism. And I also kind of direct them towards like community resources. There's like a really great autistic community on Instagram and other social media. So I'll say, read these posts, read about people's experiences, see if this is for you. Self-diagnosis is really accepted in the adult autistic community, given how hard it is to get a diagnosis. I'm technically self-diagnosed, although that is in part because I know most of the diagnostic tests and it might be difficult to give me an official diagnosis. But if people want to get an official diagnosis, they can talk to their doctor or a psychologist to get set up with testing for that.
I was interested in hearing a little bit more about how you figured out that you were on the spectrum. You said things got complex. Kind of how did that play out?
In my graduate program, I'd been good at school my whole life, but training to be a psychologist, you're not only judged how you do on paper, but also how you do, in the therapy room and social interacting. And I made, I guess, a couple of social faux pas and had some people point those out to me, and that kind of realized, maybe there's, something more going on here. And I was working in an autism research lab at the time and working with autistic clients, including clients who were women diagnosed later in life. And I just related so much to their stories. And that's when I started to explore it for myself and really kind of come to terms with, I think this might be true for me.
I think there's also, while we're talking about misconceptions for this episode, I think the language when speaking to the community isn't always quite clear to people. What phrases are preferred? I know there's people with autism, which is person first language, but then you also hear people say just autistic people, or even just autistics where it's shortened, or does that kind of depend on who's saying it and when?
Yeah, I would definitely say so. And it depends on the person. Like most adult autistics or autistic self-advocates use identity first language because we see it as a part of our identity. Like you can think about it like talking about sexuality. You would say someone is gay and not that they have gay. If, you see that kind of as your personality or a core part of your identity. And I also kind of think of it like autistics versus autistic people, kind of like saying gays versus gay people. It may be okay in the community, but you wouldn't necessarily want someone outside the community to use it that way. And I would like to note some people still do prefer person first language, and that's okay. Mostly if they're autistic, because some people don't see that as a part of identity. They may just say, oh, I have autism, and that's okay for them. I also switched between the two because I learned about autism first in an academic context that used the person first language. So sometimes I say people with autism, sometimes I say autistic.
And then there's the other term that I used to hear pretty often, which was Asperger's. I don't hear that anymore. What's the story there?
So Asperger's was a diagnosis included in the old DSM-4 to describe a more like quote unquote mild form of autistic disorder that usually didn't have as many visible challenges and may have had more expressive language use. There's two reasons it's not being used anymore. One is that for the DSM-5, all the autism diagnoses got combined under one label of autism spectrum disorders. So it's not really a medically correct term to use. Also, the community has been highlighting like the eugenicist and anti-Semitic views of Asperger and his links to the Nazi Party. So that's another reason it's not used. Some autistic people still prefer to call themselves Aspies or identify with Asperger's, and I think that's their business, but I would at least encourage them to be familiar with the history of that name.
So, what are some other common misconceptions about autism? I know I've heard that like autistic people don't feel emotions. I
Oh
think
my
that's
gosh.
probably bull.
That is completely
Yeah.
bull. And most symptoms of autism, it's kind of, you can see it as two sides of a slider. We either have too much or not enough. And that's true. That can be true with empathy as well, is people with autism are often hyper empathic. And that's been both a strength and a challenge to me as a therapist, is I can really feel my clients' emotions, but sometimes have to work harder to disconnect from that. I think that the misconception autistic people don't feel emotions is because we don't always express emotions in the same way as neurotypical people do, or how people expect it to look. So it's just seen as not having emotions when we do, it's just expressed differently.
What about, here's another one. Is autism, does it represent the same for boys as for girls?
The diagnostic criteria is definitely based on like a more male presentation of autism. Um, I would say it looks different in boys and girls, or people assigned male at birth, people assigned female at birth, just mostly because of like socialization. A lot of people assigned female at birth and people continuing to identify as women have been taught to mask their autistic traits with female socialization. So you may not see as many traits in them, and that's why it's harder to get diagnosed, because masking is more encouraged. So I feel like it's kind of the same. It just presents differently.
And what about romantic relationships? I know you've got a lot of research in that area, right?
Yeah. So as far as like romantic relationships and sexuality, I think the most important thing is that autistic people have a sexuality. Not all of us are asexual, although asexuality is a valid sexual orientation, and it's more common in autistic people than in non-autistic people. Secondly, autistic people are more likely to be non-heterosexual, and specifically more likely to be plurisexual, that is, like having sexual orientations such as bisexual, pansexual, attraction to multiple genders. They're also more likely to be a gender minority, identify as genderqueer, agender, or non-binary, as well as trans male and female. And autistic people do have some difficulty in romantic relationships, as well as all social relationships, because of like the two-way communication difficulty. We often have to work hard to understand people without autism. And it kind of gets blamed on autistic people as social communication deficits, when, non-autistic people maybe aren't putting in the work as much to understand, who we are and what we communicate about. And so I think the key for autistic relationships is key for non-autistic relationships, and that's communication, really trying to understand your partner and their needs. And autistic, non-autistic relationships definitely do work. Amy Schumer is not autistic and her husband is. I can't think of any more high profile ones at the moment, but they definitely are out there. They take work like any other relationship.
Are there any other developmental disabilities that maybe are mistaken for autism? Anything like that?
In terms of like neurodevelopmental disorders, there's a huge overlap between autism and ADHD. I've seen upwards to anywhere as like 60% overlap. And even if it's not like full diagnostic overlap, meaning someone meets full diagnostic criteria for autism and full diagnostic criteria for ADHD, a lot of times people diagnosed with one meet a large amount of criteria for the other. So that can be hard to piece out. Trauma can look a lot like autism depending on where and when the child was affected by trauma, but autistic people are often more likely to experience trauma and develop trauma disorders such as PTSD. So it can kind of be a chicken and the egg thing sometimes with autism and trauma.
Are there any other mistaken views?
Oh, I did want to talk about functioning labels. So people often talk about high functioning and low functioning autism, and that's not something that's really preferred by the community. Some people look quote unquote high functioning and that they speak and hold down jobs can look a lot more low functioning under stress. I know there's times, even after I got my PhD, I've had, a meltdown, like crying and feeling overwhelmed because of all the things I had to do, including a sink of dirty dishes. So I didn't feel super high functioning at that point. And there's some non-speaking autistics who often get labeled as low functioning, especially because they have a lot of support needs for activities of daily living, but they're otherwise very intelligent and very feeling people. So usually we prefer, rather than talking about functioning labels, talking it in terms of, visible autistic traits and most importantly, talking about support needs. What does the person need support to do?
You mentioned that autistic women are underrepresented in the research. That's true in the media as well and in films. Why is that? And how do we change it?
Yeah, I think originally it may have happened because women didn't always have as much expected of them as men, especially back in the 20s, 30s, 40s when this diagnosis was being developed. And I also think a lot of times women and femme people are able to mask some of their autistic traits just through female socialization. I think with more awareness of autism in women, that it's a thing, there'll be more research and more media portrayals. Hiring more autistic women, especially autistic women of color, decreasing stigma around autism to make it okay to quote unquote come out as autistic can also help more of us get into the fields and represent ourselves more. I also have like a great list of people to follow on Instagram, Neurodivergent Lou, Lived Experience Educator, Fidgets and Fries, Indie Narratives, Malfunctioning Autism. All these are autistic women, and some of them are also autistic women of color. And the Autistic Women and Non-Binary Network in Canada does a lot of great work supporting women and non-binary individuals that are autistic and advancing their representation.
I've often heard people say, people with autism are really good at one thing, maybe it be math or English or whatever. Is there truth to that, or?
That may be true for some autistic people. I know one of the first ways autism was studied a lot was with savant syndrome for people that seem to struggle and need support in a lot of activities of daily living and maybe to be non-speaking, but have be really good at one thing like drawing or piano. One of the people often talked about is Stephen Wiltshire, who, forgive me if I'm wrong, everyone, but I believe he's non-speaking and he is able to draw complex cityscapes after only having seen them one time from a helicopter. But that's not necessarily true of all autistic people. We have our special interests, which are things that we really become experts on, and mine is psychology. So I was lucky or unlucky, depending on how you look at it, to be able to have that for a job. And that's pretty common for a lot of autistic people to make their special interest their job. But I don't have anything I feel like I'm more skilled than most people at.
Do you have any favorite autistic characters on television or in film? Or
Yeah, I really like the character Entrapta from She-Ra and the Princesses of Power on Netflix. She is one of the best non-stigmatizing representations, and that she does have like vocal differences. She has strong interests and difficulty understanding friendships, and that gets her into problems on the show. But in the end, her friends are able to understand her better and support her. And one of the creators of that show is a queer neurodivergent person. And I think that improves the quality of the representation.
what about the other end of that? Are there any characters that you think represent autism poorly that maybe give people the wrong idea?
I think a lot of people point to Sheldon in the autistic community. People are exasperated with him, and I don't think it's necessarily that he's a particularly bad representation. I think it's just that he's very stereotypical of what a lot of people already think of as autistic, which is, a white, educated, skinny white guy who has difficulty with friendships and romantic relationships. Whereas a lot of autistic people, like, we do have friends, and it's just sometimes harder to keep up with them and that kind of thing.
Well, I just want to thank you so much for being on the show with us today. I think this has been fantastic and given people like a really good overview. Am I missing any other misconceptions?
I'm sure there's many more, but I probably can't get into all of them today.
You've just listened to another episode of Psych Everywhere. If you've enjoyed today's topic, then I have some great news. Dr. Qualls will be back in a week to speak with us again for the next episode. Specifically, for that episode, we're going to discuss the effects and benefits of perceiving autism, not as a medical condition, but instead from a cultural perspective. As soon as it's available, I'll put a link to that episode in this episode's show notes, or you can find any episodes you'd like by visiting www.Psi Chi, which is PSICHI.org/podcast. As you may recall, this season of the podcast is modeled after this year's Psi Chi presidential theme, #ConnectWithPsyChi. The purpose of this theme is for Psi Chi to help people understand and connect with fellow peers in psychology, as well as members of their communities. Psi Chi programs for this theme include a new mentorship database, and I'll have more on that coming soon, networking and internship opportunities, and social psychology content geared to help you understand and connect with others. You can read more about this theme in President Dr. Nakbui's magazine article by clicking the link in the show notes for this episode. To support this theme on the show, we've been releasing episodes on tips for networking, effects of bilingualism, learning and texting, most recently, autism, and even celebrity relationships. We've got much more coming up soon, and you can also find relevant content in Psi Chi's magazine, blog, and webinars. One last thing. If you haven't already subscribed to Psych Everywhere, go ahead and follow us wherever you listen to podcasts. Tell a friend or a colleague about the show. Word of mouth is a huge help for a podcast. So next time you get one of those pesky spam callers, take a moment and share some psychology principles with them that you learned on the show. They're going to love that. I'm kidding. Don't send me spammers, please. But of course, you could always share episodes in your classes. And you can also follow us on Twitter at Psi Chi Podcast and leave a review at Apple Podcasts or wherever you go for podcasts. You'll absolutely make my day. And more importantly, you'll be helping us to get Psych everywhere. Okay, that's all for now. I'll connect with you again soon. Copyright 2022, Psi Chi, the International Honor Society in Psychology. All rights reserved.